Hello, everybody. It's Dr. Dave back again. This is round two of stem cells and stem cell therapy. So thank you all for joining us. And I was able to very fortunately find Dr. Gonzalez in country and ready to participate with us again. So Dr. Gonzalez, thank you very much for being on board here. And we're going to just do a very brief introduction. So some of the things that we covered in the last stem cell therapy, for those of you who were on, this isn't going to be exactly the same. For those of you who were not, you may have some of the same questions. We're going to try to anticipate some of those questions based on the numerous times we get asked them. And hopefully we'll cover a lot, but you will have the opportunity to type in your questions. A couple of housekeeping details. We're going to stay on as long as we need to try to cover as many questions as possible from our audience, so this may go longer than an hour. As you can see, hopefully from your screen, if you're on the screen, tonight's special for you teleconference attendees only is 15% off our Telomere Edge packs, which are our super support system for your telomeres. And just to clarify, we don't make any telomerase activation claims with these for various and sundry legal reasons. They are a phenomenal adjunct to anyone who's taking TA65. I don't want to say they're a substitute for TA65, but they are certainly well engineered to help your telomeres stay healthy. And they are the result of audience participation, if you will, way back in 2010 and 11 when I wrote the Immortality Edge, and we had a lot of questions saying, Doc, you've got all these supplements, it's impossible to take all of them. Could you come up with something that includes all of them? And that was the Telomere Edge packs. It's already been updated twice, and don't be surprised if down the road sometime I change it, although I don't have any plans to do that now. Phenomenal product, phenomenal seller, and people are very, very happy with it. So that's 15% off tonight. We always do a prize drawing. And the prize tonight is going to be the complete RG cell set, and I have news for you on that. You wouldn't know it to look at the website, but we've revamped almost the entire product line once again. So when you understand that I pay attention to everything that's going on in the field, and everything is potentially a work in progress. We don't just create something and then say, hey, this is it. There's always information that's new. There's always information that can make it a better product, and we're constantly doing that. So for those of you who've been with me for the 13 or 14 years that I've been on the internet selling products, you understand that most of those products have been changed, added to, or improved. And by the way, the same is going to go for any of the stem cell therapies. They are absolutely bleeding edge right now. They're as good as they can get. We are probably one of the few organizations, we being Da Vinci Biosciences and our clinical arm ReHealth in Guadalajara, Mexico, where we do all our therapies, because as you know, or some of you know anyway, that it is not legal to do the types of therapies that we're doing in the United States, at least not anymore. So we do everything in Guadalajara, Mexico, and we're constantly refining and improving, and conversations that Dr. Gonzalez and I have about how to make this better and better and better. So don't be surprised if 2 or 3 years from now we have a different version of what we're doing. But I promise you that what we're doing right now is as cutting edge as it possibly can be. And there is no reason to wait, because you are aging. As you age, your body's age, your tissue ages, and your telomeres age, and your stem cells age. And this is one of the things that very few people recognize, that stem cells do age. Now I'm not going to sit here and tell you that I know every single thing about stem cell aging and every single way in which stem cells age. I do not, but I can tell you the telomeres are a big factor. I can tell you that inflammation and oxidative damage is a big factor. I can tell you that the health of the organism, that's you, is a huge factor of how well your stem cells perform. So keep that in mind. I'm going to read you something. Dr. Gonzalez and I recently had a publication accepted in Cell and Tissue Transplantation and Therapy. And I'm going to read you just the abstract of that, because it really talks, or it speaks to what we want to give you tonight. And it's a little sciencey, it has to be because it's a scientific article, but bear with us, and we're going to explain pretty much what this means, and I'm going to highlight a few things. So here we go. The abstract's short, so thank you for your patience, and then we'll get, I'm going to basically start asking Dr. Gonzalez questions based on the abstract that we wrote. So here it goes. Human aging is associated with a vast array of clinical disorders that all relate to the body's inability to maintain homeostasis. For those of you who may not know what the word homeostasis means, it means balance. It means staying within the narrow confines of what's optimal for the body. That's homeostasis. And just about every mechanism in the body is designed to help us maintain our homeostasis. And if you think about homeostasis as a straight line, maybe you take like a Sharpie, one of those Sharpies, those real fat brush Sharpies, and draw a straight line. Anything in that black area is homeostatic. Anytime that line gets wider and wider and thinner, it's outside of homeostasis. And that's exactly what happens as we age. We get sloppy in our homeostasis. Lots of things get sloppy. Our immune system, for instance, gets sloppy. Our stem cells actually get sloppy. They get lazy. In some cases, we believe there are actually fewer and fewer of them. They get what's called immunoobsessed. Sometimes they find old illnesses like viral illnesses or chronic ongoing viral illnesses that we've had, and the clones expand and expand, and they don't leave room to fight off other things. The immune surveillance that fights off cancer is impaired. The disease mechanisms for bacteria and viruses are impaired, and just in general, the repair mechanism. Because remember, your body's in a constant state of flux. The number they toss around is every 7 years, every cell and tissue in your body has regenerated itself. Some are faster, some are slower, but somewhere in that period of time. So you can see that you have to have an active repair mechanism. Okay, back to the abstract. In our bodies, the healing process requires a tight control of the acute inflammatory response. That's inflammation. Oxidation is a big part of that. When inflammatory markers, and then we name several such as interleukin, tumor necrosis factor, C-reactive protein, some of these you can easily measure, some of these you'd have to have a little bit of a special lab request for, but we've done them obviously on many, many people over the years. When these become elevated, there's a direct correlation to several chronic illnesses, such as cardiovascular disease. That's still the #1 killer, folks. Cognitive decline, that would be things like Alzheimer's disease and vascular dementia. These things are on the rise, and if you make it to between 2030 and 2050, you have about a 15 to 25% chance of having Alzheimer's and having, on top of that, another 10 or 15% of vascular cognitive decline. And of course, physical disability, which sets you up for things like falls, for sedentary behaviors, which are deadly. Probably nothing kills more people in the end than being sedentary in a hospital. So extensive studies have shown strong evidence that elevated levels of these pro-inflammatory mediators, that was those interleukins and tumor necrosis factor and C-reactive protein that we just mentioned, when these things go up, it's directly, it helps predict the disease, the occurrence of the disease, and the disability or infirmity, the sickness of the aging population. Now, right now, there is no cure for aging, but a key question is how do we modulate this inflammatory stuff? And you know, I've been going on and on and on about fish oil inflammation. Now you see the reason. To maintain healthy aging. The answer right now, or one of the answers, is stem cells, which offer alternative approaches for treating various diseases and disorders. Remember, folks, this is not something you can go to your family doctor, your internist, or even your local hospital. And if you ask them that question, you're probably going to get one of two responses. One is, geez, I don't know anything about that. Or, that stuff doesn't work. And I guarantee you that's the same type of thing that they said about a lot of what's being used commonplace in medicine now. We just happen to be on the cutting edge. Sorry, there's no other way to put that. The use of stem cells as immune system modulators has tremendous promise. And we use what are called mesenchymal stem cells. They have specific immunomodulatory properties. They help control inflammation. And both animal and human studies have shown improvements in various and sundry conditions, things like autoimmune diseases, things like rheumatoid arthritis, scleroderma, lupus, and some of the other rarer types of illnesses. Inflammatory diseases and inflammatory responses. So if there's an excess of inflammation, this helps modulate it. It's been used in graft versus host disease and many, many other areas. So what we report in this review article is our experiences with the uses of anti-aging therapies that are stem cell based, and we think they're going to serve as a way of slowing down or deterring several detrimental aspects of aging. So what does that all mean? Okay, that means we think that stem cells are going to buy us runway. until we can use stem cells for more things, till we figure out how to use them for everything we could possibly use them for, till we figure out how to combine them with diet and exercise and lifestyle modifications and omega-3 fatty acids and telomerase activations. You start putting these things together, and you've got already, right now, a really, really impactful anti-aging program. So without further ado, let me reintroduce to some of you and introduce for the first time to others, Dr. Rafael Gonzalez. Rafael, thank you for being on tonight with us.
Dr. Dave, thank you very much. It's a pleasure to speak with you and a pleasure to speak with the audience and everyone. To reiterate sort of what you just spoke about with the publication that we just have, it's basically giving you a tool presently to slow down the natural elements of aging, and also what you need to think of and consider more than anything else is to give you some leeway and give you a method of living a better quality of life. The most important thing that we all want in our life is we're going to age no matter what, but we still want to be able to enjoy the finer things. We still want to be able to exercise. We still want to be able to feel good. We don't want to wake up with pain. We don't want to wake up, you know, basically feeling like crap is what it boils down to.
Mm-hmm.
And stem cells at this point can give us that extra oomph that we actually need to do this. And it does this by the biggest problem that we have when we think of any single disease. Every single one of them have an inflammatory component to it. So what this actually does for us is it actually reduces or modulates your immune system. Whether you need some help with immunity in certain places or whether you need a reduction in immunity in other places, it actually helps you modulate it, control it, or going back to what Dave just said a little while ago, the very first key term, it maintains your immune system in homeostasis. And this is done with stem cells by stem cells releasing specific proteins that are called chemokines, cytokines, and growth factors. These particular proteins are released significantly from the cells, and it's the key way that stem cells work. They release all these mediators, and then these mediators can signal other different types of cells to whether to proliferate, to stop proliferating, to stop acting the way they're acting, and to actually maintain your health, putting you in homeostatic body and mind.
Thank you. That pretty much sums it up. So we believe, I think, and Rafael, I'll ask your comment on this. Right now, the whole crux of anti-aging therapy is clearly what you would have to call experimental. You know, I've been in this field for 15 years through the A4M, the American Academy of Anti-Aging Medicine, the AMMG, the Age Management Medical Group, and several other related groups. And the very first stuff that we had to offer people was hormone therapy. Now, hormone therapy has been attacked numerous ways in numerous places. I still think hormone therapy is a very reasonable way to address some of the issues of hormonal senescence. One of the things that happens with hormonal senescence, obviously, is your sex drive drops, your energy drops. Most people forget, and some of you who have been with me for long enough will remember a series of emails that address this. Most people forget that the so-called sex hormones often have more receptors in the brain than they do in the gonads. So you have things like estrogen, testosterone, and growth hormone, which actually affect the brain's health. And you can see behavioral and cognitive changes and associations with cognitive changes that go up. So that's pretty much all we've had for the past 15 years, along with supplementation and diet and exercise. Then along came the telomerase activation, which I think was a huge jump in the potential to reverse aging, specifically in the immune system. And I want to talk just a little bit about this concept of immunosenescence, because this combination of telomerase activation and now, for really the first time in history for the general public, if you will, for people who are really committed and willing to do this, I'm not inferring that it's a big deal, but it's not cheap. It's expensive therapy. Oh, that reminds me. For those of you, there's always going to be several people on these calls who want to actually come down and visit us. If you're interested in getting more information on the details, pricing, timing, etc. What I need you to do is to email into my customer service. It's on the website. Just go into doc at Dr. Dave's Best. That's the best way to do it. That's DOC at DRDAVESBEST. And in the subject line, write the words Tony, Tony, and stem cells. And our Vice President of Sales, Tony Delamaza, will get back to you. Just write in that in the subject line and say, I'm interested in hearing more. Again, some of you are here for information purposes only. That's fine. But we always have, half a dozen or so people who are interested in coming down to visit with us. And 2.5 weeks ago, we did a teleconference, and we had just about that many people who are now scheduling in to come down to Guadalajara and actually have the therapy. So keep that in mind. That's Doc at Dr. Dave's Best, and then Tony and stem cells, and just write in your contact information and say you're interested in finding out more. So back to the immune system. I think, and again, Raphael, I'll get your comments on this. There are volumes now written about the concept of immunosenescence, and I'm going to make it really simple. When I was a resident in medical school back in the dark ages, we had this phrase we would say that said, pneumonia is the old man's friend. And what that means is that when a person gets old and suffers, many, many times, infection takes them. Infection is the final event, and that's a function of immunosenescence. Now, I want to add something else to this. Some of you may have seen this most recent PBS broadcast called Cancer, the Emperor of All Maladies. Now, it was a horrific broadcast, in my opinion, because it talked only about how cancer is nowhere near being cured, and we're going to need another $1 trillion, and we're probably going to not be able to cure it anyway, but please send us your money. I mean, it's basically the gist of it. So what they were talking about, again, infers, and I think most people would agree, that there is a failure in the immune system when cancer takes hold, because there is an immune surveillance system out there. And when your immune surveillance system fails, lots of bad things can happen. So I would add to the phrase that I learned 25, 35 years ago, cancer is the old man's friend, and infection. And if you look demographically at what's predicted now, again, around 2030, you're going to see this trend become really, really obvious. And by 2050, it's going to be undeniable. And that is that most people will be surviving their heart disease and dying of cancer and infection because of immunosenescence. One final point, and then I'm going to turn it over to Dr. Gonzalez. In April or late March of this year, a unique autopsy was done on a 115-year-old woman in the Netherlands. Now, it was unique because it was using some of the more aging-based ways of looking at this person instead of the typical traditional autopsies. So, Jean Calmet, died in 1997 at 122 years. Man, I wish we could do some of these things on her, but we didn't have them, and I don't know that she donated her body to science. But we did have this good fortune of being able to do this on this 115-year-old woman. And what they found was that the actual telomere length in her body in general was only in the 80s, which tells us something that we kind of already knew, and that is that the people who make it to 110, 120 in reasonable shape and beyond are the people who somehow have delayed aging. They still age, but their age is not consistent with their chronologic age. We call it biologic age, and we can actually measure that through telomeres. And when we measure the biologic age, in this woman, she was only 80-some years old. But when they looked at the stem cells in her immune compartment, they were almost completely exhausted. She had only 2 functional stem cells in her immune compartment of the areas that they looked at, almost nothing left, and her telomeres in those cells were older, much older. So she died of stem cell exhaustion, probably due to telomere attrition. Now, let's just say that we had been able to bank her stem cells 20 to 30 years ago and transfuse them back to her now, that we might have been able to change that picture. So number one, immunosenescence is a real problem. It's a huge crux in aging. And number two, when we talk about stem cells, we also are offering stem cell banking for those of you who are still young and healthy. You're definitely going to want to do that. Even if you're older and healthy, I mean, I'm not a young man by any means, but I bank my stem cells because they are healthy. So, Rafa, that was a little all over the place. I apologize, but if you could comment to our audience on the role of the immune system in aging and the role of stem cells in aging.
Absolutely. So just as Dave mentioned a little bit ago, if you all start to see more and more, you'll be hearing cases of your colleagues as they age, or anybody as they age. Oh, this person over here got cancer, the other person over there got cancer. We are much more prone to get cancer when you are older. And we actually, in our lab, which all of you are welcome to come if you live in the Southern California, or you're just visiting Southern California, we're located in Yorba Linda, California, Da Vinci Biosciences, which we do a lot of studies on. We've actually looked at this, and the interesting thing, one particular cell type that we have in our body that plays a key role in your immune system and keeping it healthy and actually looking at and surveilling for cancer cells is what's called the natural killer cell. And this cell is part of what's called your innate immune system, meaning your immediate immune system. This cell type, when someone's around 20 years of age, you normally have around, throughout your whole lifehood, you have the same amount of these cells that you will have in your body, anywhere from 1 billion to 2 billion in your body that are surveilling consistently. When you're about 20 years of age, 90% of these are actually, let's say, infantry. Army, ready to kill, ready to go. 10% of them are dormant office workers. Basically, they just sit, they do nothing, and they survey. As we age, there's a shift that occurs. And once you turn to the age of about 50 to 60 years of age, depending on your general health, the shift goes so bad as to 90% of them are now dormant office workers, 10% of them are active infantry. And what we study is looking at methods of actually taking these out of your peripheral blood, meaning you take a blood sample, you take them out, you activate them, and then you put them back in. And of course, the concept behind this is actually to attack cancers, to attack other cell types, which are there's other different cell types that are detrimental to your body, like fibrosis, cirrhosis of the liver, these type of things. And those are all of a lack of your own immunity as we age, attacking and getting rid of this and clearing up your body. Now, so this is immunosenescence or immunoaging. Very similar to this, stem cells, the same exact thing. When we're conceived, when we're born, in your bone marrow alone, about 0.1% of the cells in there are active stem cells, what I mean blood stem cells, that can convert into different blood types. As we age, when we hit 40 to 50 years of age, this now goes down to 0.0000001% approximately of your bone marrow is now a active, strong stem cell that does its job correctly. So that's we're talking about a 10,000-fold difference in the amount of cells, stem cells that you have in your bone marrow now when you're in your 40s or 50s as compared to when you were conceived. Very, very similar concept if you think about it as when you're conceived, you actually have about 10,000 base pairs, telomeres, and your telomeres, and when they become critically short, they go down to 5,000, half of that. And this is, of course, during a lifespan of 50, 60, 70, depending on your own condition, depending on how much you take care of yourself, and depending on what's going on. So our body, once we go back to, again, the whole exact concept of homeostasis. Our body all works consistently trying to keep us healthy. If one component ages, the other components will age too. Your immunity, your stem cells, everything else. The telomere shortened, we actually have proof that we actually did studies here that we can look at as we propagate and as we passage, meaning as we take stem cells and we grow them up and we passage them and we make them more and more and more and more and more amounts of them. And as they age, because it's basically a not an unnatural healing, an unnatural aging process that we do in the lab, the telomeres actually shorten significantly, whether it's from a bone marrow stem cell, a fat stem cell, or an umbilical cord stem cell. They will all age.
And we
And it's
can use that, Raphael, correct? We use that as an aging model to test various and sundry things, interventions that we're planning on doing and that we are doing.
Yes, absolutely.
Okay.
Absolutely. So we can, yeah, we can actually look at different, for instance, you can look at omegas and use these types of models to see if they actually stop the detriment of aging, stop inflammation, look at inflammatory, look at immune cells and add omega to them in vitro. This is all across, of course, in an artificial environment, in vitro, which is what we do here, which is the way all scientific studies are basically done to validate anything in the future before it actually goes into a patient. We've actually done quite a few studies here in our company here in Da Vinci Biosciences that supports the Mexican entity, our collaborators in Mexico ReHealth, to demonstrate that we're using the correct cell types for different individuals. Every single one of us, once again, is different. If a person has an autoimmune disease, we would definitely don't want to use the person's own stem cells because those stem cells are affected. If the patient has a blood disorder, we definitely don't want to use bone marrow from that patient. So therapies that we work on are specifically tailored, because every single one of us are different, specifically tailored to each and individual person that goes and gets them done. Once again, we've talked about this before. Stem cells is not a cure-all. Stem cells actually doesn't cure anything besides, and it doesn't even do that. It actually puts it in remission. Cancer, when we talk about a bone marrow transplant, what's working there is the stem cells. But remember, this actually requires for you to go through a chemotherapy to wipe out your immune system, and then it uses stem cells to reconstitute or to reform or, let's say, reboot your immune system and your blood system that's in you. And then the cancer is cancer-free. It normally puts you in remission. That's all it does. So it does not really cure you. You're in remission, and there's still possibilities of that cancer coming back. Stem cells can, excuse me?
Go ahead.
So stem cells can change your quality of life. And when we discuss changing your quality of life, we're talking about significant changes. We're talking about a patient that has heart failure class 4. This is someone that cannot bend down, tie his shoe without losing his breath, without losing balance, with it being a difficult task, versus that same exact individual, after having a therapy done, is now walking a block, 2 blocks, 3 blocks, even possibly even playing a small, half round of golf or something like that. That's a significant change in your quality of life. Someone that couldn't bike before because they have rheumatoid arthritis is now biking again, exercising, living a normal life again, doing the things that you used to love to do. These are what we're talking about, changing the quality of life. But once again, it's not a cure. We're not talking about regrowing organs or anything like that. Go ahead,
Right,
Dr.
I was going to say we should probably talk a little bit about that, but I want to focus a little bit more on the actual anti-aging aspects, because while we do certainly ReHealth in Mexico, in Guadalajara, Mexico, we do treat plenty of illnesses down there. There's no question about that. Still, the bulk of our focus right now is on anti-aging and regenerative medicine. So the question that some of you might have while you're listening to this is, well, wait a minute, I'm healthy. I do everything. I want to know that these stem cells make me healthier. So you heard us talk initially about immunomodulation and improving the immune system. We expect certainly that the stem cells that we use not only reboot the immune system, but help reboot other areas of the body that may be damaged. And you heard Dr. Gonzalez talk about cytokines and chemokines. Now, I use the word damage. Damage is something that you may not perceive. You may feel great, but your body may not be in that perfect zone of optimal homeostasis. And we believe that not only does this affect disease tissues, but it makes tissues that are subclinically damaged, which happens with aging. That's the process of aging, a slowing of the regenerative process, an inability to keep up with the damage. You don't feel it because Mother Nature and God and the universe put things in your body as reserve. But eventually, 60, 70, sometimes younger, sometimes much older, you run out of reserves. And we believe that our stem cell therapies are critical for maintaining that homeostasis and improving your ability to get a hold of reserves. Another question that people ask, and I covered this, some of you were at David Wolf's conference, I covered this and that is the issue of, well, what's really causing all these changes, and is it some sort of genetic thing, or is it some sort of irreversible damage? And so let me sum this up very quickly. The damage control of your body can really be divided into two areas. And the division is an artificial one because every tissue probably has a contributing factor from these two areas. But some have more than others. And I'll get to that in a minute. But that would be the pre-existing differentiated cells, like skin cells, liver cells, heart cells, vascular cells. We call those somatic cells. Somatic cells. They make up the bulk of your body by far, probably 99.99%. And then the rest are stem cells and some circulating cells. So in those somatic cells, you have the telomeres, which shorten as we get older. The ability of those somatic cells to divide into healthy new tissue is very much dependent on telomere length. So that's area number one, somatic cells and telomere length. Then you have your sort of emergency reserve parts bags. And when I say emergency, it doesn't have to be an emergency. It can be a low-level damage. It can be a high-level damage. Those are your stem cells, the National Guard, so to speak. They come in when the somatic cells are not able to make up for the damage that occurs. And again, this is an artificial thing because some tissues, for instance, we talked about the immune system and blood, these are very rapidly dividing. Skin is very rapidly dividing. These tissues require huge volumes of stem cells relative to the other tissues that are non-dividing. So it is a combination of somatic pre-existing cells, telomeres, and your parts bags, your regenerative cells that repair your body and regenerate your body. And that's what aging really is. Aging is the slowing and the loss of the repair ability of your body due to the probably mostly telomere attrition in your somatic cells and stem cell attrition. So we know how to address the telomere issue right now. We have TS65, we're working on other compounds, but the stem cells is a second, and because they're so prevalent in so many important tissues of our body that are rapidly dividing, such as blood vessels, skin, liver, and several others, of course, the immune compartment. These are areas that will be manifesting as aging in a person who is aging prematurely, may get vascular disease or cancer because of immune surveillance, or other illnesses that we identify. It could be vascular dementia in the brain or the inability of the brain to clear out toxins, which manifests itself as Alzheimer's disease. So this is why we use the stem cells. We want that immunomodulation. We want that second part of this big equation in our tissues to help keep us young. And as fate would have it, it is actually the easiest to do the anti-aging therapy. So, Raphael, could you just describe the simple, basic anti-aging therapy, and then we can talk about how we can morph it into other things. And then I think we'll take questions. Oh, one other thing. I do want to say or remind everybody, if you want to come down and visit us in Guadalajara, Mexico, or you want to find out more about the actual therapies, you want to write doc, D-O-C, at Dr. Dave's Best, DRDAVESBEST.com, and in the subject line, write Tony and stem cells, and we'll get back to you and answer as many questions as we possibly can for you. And as you heard, Dr. Gonzalez kindly extended his invitation to come visit the Da Vinci Biosciences facility in Yorba Linda, California, if you're in Southern California or traveling through. It's an amazing facility, and because I know Dr. Gonzalez takes such wonderful care of our patients, you'll get personal attention if you show up for sure. So that's it for housekeeping. So Dr. Gonzalez, take it away. How do we do this?
So the key word that you actually said is repair, and these stem cells, for anti-aging purposes, these stem cells, they serve as a mediator of repair. We all have stem cells in our body now, and just because we have stem cells in our body doesn't necessarily mean that they are working, that they are activated. The vast majority of them are actually in a dormant state, that they're not working correctly. When we take stem cells and we grow them up, or when we take them out of your body and then when we reintroduce these back in, these actually release these cytokines and these chemokines and these growth factors, these proteins that actually can activate your own endogenous, your stem cells to actually do the repair that they're supposed to do. And this is what's actually been demonstrated in animal models several times. For instance, in diabetes, it's not necessarily the stem cells that change into beta cells, insulin-producing cells. It's the stem cells that release these factors that we talked about that cause your own tissue to activate stem cells and to cause those stem cells to change into a beta cell, or to cause those stem cells to change into a vascular cell that will now supply the new blood needed, the new vital blood that's needed to supply oxygen to that organ so it can work correctly. This is how the repair mechanisms of stem cells help. This is how the repair of, even like Dr. Dave said, hey, I'm a normal, healthy individual. Why would I need this? Every single one of us have that little extra thing that they want to do. For instance, we treat UFC fighters. We treat elite athletes. And some of them come back to us and say, you know, I remember when I was 20, 25 years old, and in between my rounds of fighting, my recovery time was 15 seconds rather than 2 minutes. And in theory now, as a boxer, I only have 1 minute to recover. I want to get back to the way I was before. How can I do this? Or just that regular, normal person that wants to be able to lift that amount of weight that they were able to lift when they were 25, 30 years, whatever it was. That little step that's needed is how this can actually help you get to that next step. And it's something that we see regularly in a lot of athletes, and even you're weekend warrior. You know, I being myself, I mean a weekend warrior because of course stem cells and medical life and all this takes up a lot of our time. But we have to find time to exercise. We have to find time to do what we ever want to do. Well, what helps me is that stem cell. It definitely helps me. Now, it's a relatively simple procedure, which all that basically happens is if you're a healthy individual, you would actually go down to Mexico, and once we do a pre-screening of you, meaning we would look at specific blood work for you, we would of course get a full history of what's occurred with you previously. Even if there's nothing occurred, we want to know everything, and we will require specific blood work to be done prior to us saying, okay, you're a good candidate. And then you would come down, and what occurs is a light sedation, which is a propofol sleep, where you're actually slightly put under. Twilight sleep is what it's called. There's an extraction of some bone marrow that's actually done from your hip bones in the back. Very, very painless procedure, so much so that I've had several procedures done, and I've actually tried them all now. Actually, I finally did the bone marrow one 3 weeks ago, and I was blown away, so much so that the next day I looked at my back and I looked at my hip in the mirror to make sure that I had bone marrow extracted because I couldn't believe how painless it was. I mean, Dave, you've had this done too?
Yeah, it's beyond simple, and one of the things Dr. Gonzalez told me was, give it a day or two before you do anything physical, and maybe better part of a week. And of course, being the typical physician, that night I was on the exercise bicycle pounding it, and I was in the gym the next day. Now, I'm not saying you guys should do that out there, but the point is that this is a really benign, simple, and painless procedure. And that's not the case. So let's hear about your fat extraction, Dr. Gonzalez.
Yeah. So I've had that. So you can get stem cells from fat, and I've had that procedure done. And the issue is that when you're gonna, I mean, it's another method, and it's a valuable method, and it works. The issue is that if you're gonna get some fat extracted, if you're gonna remove, you have to remove to grow it up, or at least if you're gonna do it on the spot, you need at least 100 cc's of fat, 100 mLs of fat. And if you're gonna take that amount out, it's pretty much a substantial amount that it can leave an indenture in your abdomen, in your arm, in your leg, wherever you're going to remove that. That's going to be noticeable. So if you're going to do that, you might as well have a slight sculpting, or what's called actually a mini liposuction or something similar, that it's actually removed from two of the,
The
symmetric areas,
sides, you know.
so it looks the same, and it looks good. It's painful. I mean, it's the following day, it hurts where the fat was removed. I mean, there's a substantial amount of muscle pain, and there's actually some numbness in the area that actually persists for, it depends. Everybody's different, but anywhere from 2 weeks to a month at least, I've heard. In my case, I said, why not? I'm going to have this done. I had 250 cc's done, both flanks completely removed on both sides. And then at the same time, since you're doing a mini liposuction, you have to consider that you got to wear a belt for about a month. There's leakage the following day. None of this happens with the simple procedure of the way we do this. If you're a healthy individual, we just take it from the bone marrow. We can extract out a substantial amount of it. We can actually re-inject it, introduce it back into you. And at the same time, we can actually ship this and store this so you don't need to have this done again for future use in our FDA-registered company that's called the BioBox here in Yorba Linda, California. And it makes your next procedure, if you happen to have a next procedure, if you need another procedure, if you want another procedure, if in the future if you're healthy and all of a sudden, God forbid this happens all the time, one day to another, one thing goes wrong. This happens regularly. You will then have stem cells stored already and you will be ready to go. You can use those stem cells for another procedure. You don't have to have a procedure done again.
So I think that you really touched on a couple of the things that I want to bring out, and that is by far, well, let me not say by far because we do a lot of experimental therapies, but let's say a majority of the people that we treat with this type of therapy are healthy and they want to get healthier. And we treat a lot of people who, we have patient doctor privilege. I can't name their names, but these are people you would certainly recognize. And they tell the same story. We're busy, we're healthy, there's not enough hours in the day, we don't always do exactly everything. We take our fish roll, we take our TA65, but we travel, we're on airplanes, and they live these very, very high pressure, high level lives. And again, they're buying runway with the stem cell therapies. We have lots of people, and I know that we have health gurus, David Wolf being one of them, who understands that we have to do things differently than our parents did, and this represents an incredible jump forward in what we can do today, now, versus what our parents and grandparents had. They didn't have any anti-aging therapies. As I mentioned, 10 or 15 years ago, all we had was hormones, vitamins, exercise, and diet. Now we've got telomerase activation, and we've got stem cells. This is, we've gone to the next level. We've raised this logarithmically in terms of what we can do to improve our aging processes and qualities of life. But a lot of the people we treat are healthy. They want to come down and stay healthy. And the issue of coming for more treatments, usually what happens is that we don't have to ask anybody. They just tell us we want to come back. And that's why it's good to have your stem cells banked. And you want to do that while you're healthy. So if you're 45, 55, 65 and healthy, then that's a great time to not only get the procedure, because it sort of reverses those subclinical things I talked about before, but it also improves or it gives us this bank of young cells. And your stem cells generally are going to be younger than the rest of you anyway. And so let's say I'm going to make up some numbers. Let's say you're 55, young and healthy. You're physically healthy. You don't have any medical problems. You do everything you're supposed to do. You're the perfect patient, okay? You come down and you get your stem cells. Your stem cells might only be 40 or 35. And they keep for several decades, and we are probably going to figure out ways to extend them even longer. But the bottom line is if something happens to you when you're 65, even 75, we have that bank of young, healthy stem cells that we can help you deal with that issue. Very quickly, I think it's time to go into some other things and take some questions from the audience. So again, I don't want to focus on diseases, but I want to let you know that we do have that clinical arm where we don't just treat healthy people and make them healthier. We treat a lot of sick people. But I want to just comment, because we always get questions about, can you grow me a new pancreas? Can you grow me a new trachea? There was this guy over in Finland that grew new tracheas. Those therapies, now that we're a year or two out, are not looking very good at all. There's a lot of complications in growing new stem cell-based tissue. So that type of stuff is not here yet. Here are some of the illnesses that we treat. Once again, Aging, I think, is an illness, so I'm going to put that in a category. No one else, well, not no one else, but most doctors and the FDA, of course, doesn't approve of this. But I think aging is a treatable illness, and I think this is part of the treatment for all the reasons that we just covered. Next, we cover vascular things, especially claudication in the legs. Claudication is a condition where people get extreme muscle pain when they walk a certain distance, and we can treat that with stem cells. We treat cardiovascular illnesses, heart disease, and other types of cardiovascular illness with stem cells. Um, we, uh, we treat a lot of joints, knees, hips, elbows, and other joints that are people trying to avoid surgeries, people trying to avoid trauma, more trauma to the joint, or better yet, the typical joint scenario is, okay, 65-year-old person goes for a knee replacement, and a year later they got to have a hip replacement because the weak link in the chain was the knee, but right behind it was the hip. So we treat joints as well. We treat a lot of those. We treat neurodegenerative disorders, Parkinson's disease. We treat diabetic neuropathies, a lot of success with neuropathic pain and with also the vascular issues of diabetes. Some, I would call them near miraculous results at healing some non-healing ulcers in diabetics. We can help the young diabetic if they're young enough and diagnosed soon enough. If you have a child, for instance, who's had type 1 diabetes for 5 or 6 years, that's not something that stem cells are going to be particularly helpful for. But for the type 2s with the vascular issues, with the neuropathic issues, and those kinds of things, and just general de-aging, because diabetes type 2 accelerates your aging process. And we treat also the autoimmune diseases that we mentioned with a special type of therapy, rheumatoid arthritis, scleroderma, lupus, and some others. And we are very, very selective in terms of what we tell people and what we're capable of doing. So when it comes to illnesses and diseases, you're going to sit down with us over the phone at least, and possibly face-to-face if you come out to Yorba Linda, and we're going to get your complete history, and we're going to tell you straight up, this is what we can do for you, this is what we cannot do for you. We're not going to lie to you about we can cure we can reverse every single thing that happened to you when you had your stroke, those kinds of things. We get a lot of that. People who have had debilitating illnesses 5 or 10 years ago that want to know, can you grow me a new brain, can you grow me a new, we cannot do those kinds of things. For most conditions, however, we can help a lot more than what you've been doing. So that's what I want to preface it with. I guess what we ought to do now is we ought to use some time for audience questions. So before we do that, Patrick, you can open up the forum, but I want to just remind everybody, tonight's special is 15% off the telomere edge packs. You can see the coupon there is Telecon. Just enter that in, you'll get 15% off our telomere edge packs, which are your telomere support product. It's been very, very popular for 4 or 5 years. Some lucky person who Patrick's going to let me know is going to get a whole set of our brand new revamped RG cell. And you heard Dr. Gonzalez talk about cytokines and chemokines. We're putting those things in the skin therapies now to wake up your skin stem cells. And I mentioned to you that skin is actually a huge repository of stem cells. So there's a lot of ways that we can use stem cells therapeutically, and that's one of them. So some lucky person's going to get that, and look for the new revamped stuff on the website. For those of you who want to come down and know, this is your second time with us with Telecon, or you already know that you need a stem cell therapist or you want to do them, just email me at doc at Dr. Dave's Best. That's doc at DRDAVESBEST.com, and type in the word Tony and stem cells, and then we'll go ahead and have direct contact with you. So we have some questions. Dr. Gonzalez.
By the way, Dr. Dave,
yes,
just wanted to didn't mean to interrupt you, but by the way,
sure.
just to let everybody know, RG Cell is a phenomenal product. We've actually tested it here, and besides us testing it here, I love it myself, because after I tested it, I said, I got to get on this stuff. And I can tell that my skin feels and looks phenomenal after it. And my wife, which has been in the cosmetic industry for greater than 15 years, thinks it's the best product that she has actually used. And she's worked for different entities all these large ones that you see out there that you've heard of out there. Um, she's worked for them for years, and she's tested all these different products, and she says it's an amazing product. So
Thank you.
I commend you on that product, and it is a great product.
Yeah, and it works, and we've been able to show,
Yeah.
increased collagen generation, et cetera, those kinds of things. And this is not a joke anymore. I mean, this is what's so exciting about being alive. And I have to tell you, when I first joined the anti-aging medicine field, it was very, very small. And as I said, we only had hormones. That was pretty much it. And, even some of the anti-aging docs weren't big fans of high-dose omega-3 then. They are now, most of them. And of course, we've got some, CoQ and a lot of other things that are directly acting on things that we believe are going to impact on our aging process and slow it down. But telomerase activation and stem cell therapy are just in a class by themselves. Let me just jump into the questions. We've got a bunch of them, so we want to try to answer all of them. The first question is from Rashid. It says, what are the available stem cell rejuvenation technologies currently in practice? And I'm going to turn that one over to you, Dr. Gonzalez, but I'm just going to make a comment. You're going to hear a lot of people talking about using point of care therapies. So Dr. Gonzalez, that I believe is still legal in the U.S. You're going to hear about people using PRP with stem cells. We obviously do that as well. You're going to hear people asking or talking about laser excitation of stem cells. So I guess, Dr. Gonzalez, sort of run down briefly the stuff that's out there in the U.S. that people can still do versus what we do in Guadalajara, Mexico.
Sure, absolutely. So the methods, the modes of using what's called autologous stem cell therapy, which means it's autologous means it's from you, from the same patient, is they either do a bone marrow extraction or they do a fat extraction. When they do a bone marrow extraction and when they take it and they centrifuge it and they separate out a specific layer and they make what's called a bone marrow concentrate and they reapply it at the same time as they did it, meaning within a couple hours, sort of an inpatient procedure. This is actually what's called point of care, and this is actually allowed in the U.S. However, this is allowed for specifically for orthopedics, not for anything else.
Not anti-aging,
So,
that's for sure.
correct. It's not allowed for anti-aging, and it's not allowed actually to put it systemically into a vein. So you're not allowed to do that here in the United States. The same goes for fat. And to the contrary with fat, actually, when you take fat out, it's a little bit different than bone marrow. You actually have to manipulate it with an enzyme to dissociate the fat completely. You have to use an enzyme, and you have to dissociate the fat completely, and then you obtain a specific cell layer, and then you put that cell layer back into a person. You inject that back in, and there's stem cells in there. It's not a purified stem cell, nor is the bone marrow one that we just discussed. This is a cocktail of cells, and it contains stem cells in it. That's why it's called bone marrow concentrate, or they also call it a buffy coat, or they also call this a mononuclear cell fraction, because those are the cells that are in there, in that fraction. When you have fat that you dissociate it using an enzyme, you have what's called the stromal vascular fraction that contains also, again, a cocktail of cells, various different cell types with stem cells inside of it, and that is actually what's actually used. So some of the cell types that are in that cocktail are endothelial progenitor cells, which these cells serve to form new vasculature. There's, of course, a lot of red blood cells in there, meaning just regular red blood that's in there. There's small percentage of stem cells in that whole cocktail, and also in the bone marrow there's a small, it's a very small percentage of it unless you purify these things. And there's a couple other cell types in there that can be of benefit, immune cell types that can be of benefit in these two different cocktails that are used in adult. Now, when you use stem cells from someone else, these are actually modified or grown, and these are actually called mesenchymal stem cells. We can actually grow them from any single body that we get the other stem cells we talked about. Meaning if I can take fat or if I can take bone marrow from anyone, I can now take that and purify the stem cells in there and grow them up in petri dishes, in culture, and I can grow them up and I can expand them and I can produce clones of stem cells that are called mesenchymal stem cells. And I can use the mesenchymal stem cells from fat, and I can use mesenchymal stem cells from bone marrow. But normally when we use from someone else, they can either be from bone marrow, but normally they prefer using it from the younger the donor, the better, of course, or umbilical cord. And this is actually called allogeneic because it's what's called an allo product. It's from someone else. These cells that are expanded, culture expanded, are actually have properties that can immune modulate. They can actually control the immune system by suppressing it or enhancing it. These are actually used in diseases such as pediatric graft versus host disease, which is actually approved in Canada. It's when basically somebody has, let's say, an organ transplant, and they normally put them on these corticosteroids. They put them on these massive amounts of steroids so they don't reject the organ that was given to them. Well, now they use mesenchymal stem cells, these stem cells that are from someone else, to suppress that rejection of that organ that's been put in. And these cells have amazing properties. These are the ones that we produce, that we can produce in our lab, and then these are the cells that I can actually go back into you. Whether they're from you or whether they're from a screen donor that has no genetic abnormalities, that has been tested for what's called chromosomal aberrations. Because when you grow up cells in culture in vitro in a petri dish, the properties of the cells can change. And the chromosomes can actually have deficiencies or have problems with them that can cause problems when they're actually put back into a person. So all these things are tested, and then the cells are deemed safe. You know, they're tested for bacteria, for viruses, donors are screened, and then the cells are actually put back into individuals, anybody, I mean, who not anybody, but anybody that is a candidate for a therapy, anybody that qualifies. If we're running a clinical study, for instance, we're running one now for rheumatoid arthritis. If you qualify and you have rheumatoid arthritis and you fall under the inclusion and the exclusion criteria, you can qualify to have these type of procedures done, just like a regular clinical study that Pfizer, Amgen, et cetera, do out there on different drugs. And it's pretty much the procedures that are now these are the latest ones that are used currently. Now, in the future works, we're talking about, you know, and this is who knows how many years from now, because there's still a lot of work that needs to be done, taking where we produce sort of like an embryonic stem cell from each individual patient, and these are called inducible pluripotent stem cells. And these are basically, we take a skin graft from a patient, or we take a small amount of blood from a patient, and we culture this, we grow this up in vitro in a petri dish, and then we actually add 3 to 4 different genes into this culture, and we sort of de-differentiate, or we make your old cells now young. So we bring them all the way back to an embryonic state from when you were in embryonic state. And from there, we now have the capacity to change those into any single cell type that we want and we can use. Now there's still problems with that technology, because just like if you think of Dolly and you think of cloning, there's always a genetic imprint of what we've had before, and these are what's called methylation patterns. And these will always persist in your DNA, they will always persist in your body. And this is what actually occurred to Dolly. Dolly aged prematurely. She died right away because even though she was conceived in a couple years, she still had that imprint of an aged individual. And this was the problem with that technology, and this is the problem that still somewhat persists with this new technology that's out there now. And of course, there's always, that's been controversy with is the embryonic stem cells. The embryonic stem cells persist. They're an amazing research tool, and in some future dates, when that technology is perfected, it will be useful. It'll have its purpose, just like what we do now has its purpose. And the purpose is right now is to keep us healthy now, to make us live a better quality of life now, and to make us feel better now. And that's the idea of putting adult stem cells into your knee if you have a bad knee, avoiding that knee replacement, putting stem cells into your hip, avoiding that hip replacement, because there's no guarantees with those either. Your physician may tell you, I'm going to do a surgical procedure and I'm going to replace your knee, but forget about running. You're not going to be able to run. Forget about biking, and forget about any guarantees that that pain you had previously is going to go away, because there is not a guarantee for that. So at minimum, if you take the stem cell approach, you actually have a natural approach that may help you, just like the same exact amount of chance you had when you were going to do that knee replacement, which is a surgical procedure, which is modifying your life completely.
And permanently.
And permanently, exactly.
Yeah. So that's a A to Z answer to the question.
Yes.
Just
Sorry, it
for
was a little
those
long.
no, but that was the question. So I just want to, for the audience who's interested in coming down to Guadalajara, or who is thinking about this long term down the road, um, the bulk of our patients get their own stem cells back. So they get the buffy coat right away, and then from the rest of it that we keep, Dr. Gonzalez fractionates, if you will, or removes those mesenchymal stem cells, those amazing cells that are functional and modify the immune system, have anti-aging benefits, and also encourage your own tissues to regrow in a healthy fashion. So those come from yourself. A small percentage of our patients, because they have underlying illnesses that preclude it, or because they're too old and too sick to really benefit from their own stem cells, which are also too old and too sick to be of benefit, will get these embryonic, these cord blood cells, and
Cord
these
tissue.
so-called cord tissue, the so-called allogeneic cells. So let me move to the next question, because this is from a person in Mexico who has MS and wants to know the screening process. So Dr. Gonzalez mentioned they're screened for genetic abnormalities, they're screened for viruses, they're screened for infections, and then the actual viability of the cells is also screened and tested. And that goes for all of our cell samples that Dr. Gonzalez works with. There's a rigorous quality control thing that I've never seen duplicated anywhere else. It's too detailed to go into here. But every step of the way that we process these cells, we check for viability, we check for efficacy, and obviously we make sure that if we're using cells that are from cord tissue, that is completely healthy within every parameter, infectious disease, chromosomal abnormalities, metabolic abnormalities, etc. So we do everything that is possible to do. The next question, a young lady who would like to get, or is considering getting pregnant later in life, and has heard about eggs created in mice from stem cells. This is a different type of therapy. We don't actually do those kinds of things. I'm guessing that we're far away from actually using that in clinical trials, but Rafael, you want to comment about that?
No, that's actually talking about I mean, producing eggs from stem cell. This is actually really, I mean, this was of course done in mice,
Right.
and when we try to translate something from a mouse to
Human.
humans, it's a completely different animal. So much so that one of the companies that we actually that I work with here, we actually produce human cell-based models, and if you think of all the testing and all the R&D that's actually done on mice, 95% of everything that's shown in a mouse never translates into the human condition. So although we are, I think it's like 90%, 92% homologous, similar to mice, that 8%, 10% is a huge difference in the genome.
Mm-hmm.
And it accounts for, you know, a mouse that has a severed spine and then gets a small injection of something and is able to walk again, versus a human being. We're completely different, complex individuals, and that's why studies on human cells, on human primary cells, on these type of things are very, very valuable for us to learn. But no, at this point, we are nowhere near producing eggs and actually testing if those eggs have the correct genetic components to actually produce, of course, a viable offspring is the most important part.
Right. And the other thing I would mention is we have women who are interested in getting pregnant later and later in life, postmenopausally, and they want to use the rejuvenated eggs. This is not a small number of women out there. But I want to remind you, ladies, because I've seen some of this type of stuff done with artificial implantations and those kinds of things. Having a child when you're 55 or 60 as a woman is an incredible stress on your body. So I urge you, those of you who are thinking that, oh, well, they're going to perfect this, it may take 10, 20 years, but they'll perfect it, I can have a baby when I'm 70. Yeah, theoretically that's possible, but you better start doing every single, if you're really serious about that, you better start getting your stem cells now. You better get on TA65, you better get on high dose fish oil.
Better be healthy.
You better be, because it's turning back the clock from a 65 or 70-year-old woman to a 35-year-old woman is a big ask. And I'm not saying that we're not going to get there, but we're not there yet. And again, I want to repeat in case anybody missed it, the actual new tissue generation, for instance, the tracheas that were grown on plastic and transplanted, those have been fraught with problems. So even that type of therapy is not perfected yet. That'll be available sooner, I think, than the eggs. Next question is near and dear to my heart, and that's, is it possible to improve the vitality and health of stem cells that are being preserved? That is, to improve the health and strength of the stem cells post-collection, after they're collected and drawn, is it possible to do that? The answer is we are working on that very issue as we speak. We think it's going to be possible, and we should probably have something, some data on that within I'll say within a year or so. That's one of the things that I'm very passionate about, and I thank God that I met Dr. Gonzalez, who's given me the opportunity to take some of my ideas and put them into play in an arena like this, where we combine these two wonderful fields of telomeres biology and stem cell biology. The next question, similar question, is when you grow the stem cells out, do you age them? Yes, you do. You actually do. But remember, most people's stem cells are much, much younger than their somatic cells. So it's not like you're getting old stem cells just because we've expanded them. And we're only expanding a small fraction. We have a large fraction of cells to expand. And Dr. Gonzalez takes a small part of what we save and expands it, and does that every single time. So we're not, using older and older cells. I think it's a good question. The audience is pretty sharp. Next question was, do stem cells age faster or slower than stem cells which are in the body and have not been taken out? The answer is, when you force replicate cells, they do age faster, we think, but since we don't have real-time evaluation of stem cells in their niches, we don't know the answer to that for sure. But I will say this much, and Dr. Gonzalez, you might want to comment. TA65 remains a controversial product. There's a lot of people who don't want to believe that it works. There's a lot of people who prefer to look at the negative sides of it versus the positive sides of it, and to say, well, it doesn't work in everybody, and it only works in some people. And that is true for various and sundry reasons. I don't think the compound is ineffective. I think, unfortunately, people need different doses, and there's no good way to know what that dose is, which, by the way, is why I've been on high dose since I started. But one of the things that we've noticed with the patients on TA65 is that their bone marrow seems to be younger, healthier, or at least more cellular is a better way of saying it. And I've correlated that with Life Length over in Spain, the folks that look at these samples that we send them, and I firmly believe that telomerase activation, aka TA65, is working on bone marrow stem cells. And if you look at its effect on things like T helper suppressor cell ratios, it almost has to be, because these are high turnover cells that are dependent on stem cells for their numbers. I'm going to turn this next one over to you, Dr. Gonzalez. What would be the ideal age to bank cells? And at what age do the benefits of cell banking start to diminish? I'm going to answer the first one. I'm going to give you the second one. The first one is, the sooner the better. It's never too late unless you're already sick and declining. Then we have this other product, which we use in a small percentage of people, the allogeneic product, or if you have a special condition. But I mean, we've had people ask us, is it too young to come down when I'm 35? Absolutely not. Absolutely not. If I had these therapies, I'm between 55 and 60. If I had this stuff when I was 25, 35, my God, I would have been there immediately. So the second part of that question do you think there's an age where stem cell banking is pointless, or they diminish, the benefits diminish? Dr. Gonzalez, want to comment on that?
No, I don't think there is an age, and it just depends on. It goes back to one thing: your general health. If you're a 65, 70-year-old individual that is healthy, no, you should bank your stem cells. You absolutely should. But if you're a 65, 70-year-old individual that is not healthy, you know, if there's a lot of health issues that are going on, cardiovascular disease, autoimmune diseases, a bunch of different things going on together, you at that point would say, you know what, it's probably not worth you banking your stem cells. But I can tell you, I met a gentleman last week that was 78 years old, blows me away. The guy runs 5 to 6 miles, 3, 4 times a week. I mean, the guy is in phenomenal shape. And there's no reason at all why this 78-year-old person, which is what we discuss, cannot bank his stem cells now, because he doesn't know if in 5 years from now he's going to be in the same condition that he was then.
Right.
And his stem cells will be useful at that time.
Great, thank you. It's a nice clinical vignette, and so it's not age dependent, it's person dependent. Remember, there's a difference between chronologic age and biologic age. And I can tell you my biologic age is definitely younger than my chronologic age. I can tell you the same thing for some of our other clients who are health gurus who pay attention and really make this part of their passion, if you will. So there's no question you can impact on it, and presumably, and if we're fortunate, and I believe this, I believe that if I get a bone marrow extraction 5 years from now, I think my stem cells are going to be younger than they were 2 years ago when I initially had that extraction. And the cool thing is we'll be able to run that as a study, right, Rafa? We'll be able to look at that and give an honest assessment of biologic age and see how successful. And by the way, I'll take status quo as successful. If I stop aging at 50, I'll take it. Even if I'm 60, 70, or 80, even if I'm not de-aging, which at this point it appears that I am, I will take being a certain age for a much longer period of time biologically. Next one I'm going to handle is what supplements can one take in the meantime while one might be waiting to try to afford the advanced therapies to maintain stem cells. I hear things like D3, L-carnosine, wild blueberry, pterostilbene, etc. So what can we do in the meantime? Well, obviously I'm a supplement designer, and one of the things that Dr. Gonzalez and I are trying to do is to take the guesswork out of stem cell supplementation. Everything that was mentioned here, and a few that were not, D3, L-carnosine, wild blueberry, pterostilbene, theoretically, these should all have some benefit, but I don't know of any in vivo or in vitro studies that have ever looked at any of this stuff and been able to prove it. And I want to bring out a point. If you look at these, some of these, particularly the L-carnosine and to some degree the D3, people have written articles about, oh, these are telomerase activators, and here's the data. They're telomerase activators in a lab, and that's very, very different for a couple of reasons. Number one, stem cells in culture, you really have to be particular about how you test them to try to reproduce the in-body experience. They're different. And Dr. Gonzalez is an expert in this kind of thing, which improves the data, but there's nothing like having it inside the body to look. Second of all, it's very easy to dump as much as you want of any supplement, irregardless of whether that's an achievable dosage. And one of the things that I'll quote here is the carnosine. Okay, so carnosine is tableted and added in my telomere edge packs as a telomerase activator. Well, it is at extremely high doses, but the doses that you have to take to get that single isolated supplement to turn on telomerase and presumably affect your somatic cells and maybe even your stem cells is much higher than a person could tolerate. So theoretically, yes. What really works? I think the only thing I'd put my money on at this time, I would say D3 is useful because it's a really good essential hormonal supplement. Carnosine is important because it's a very potent antioxidant. Any berry extract that has a high antioxidant quenching ability is probably worthwhile. Pterostilbene, I'm not convinced it's any better than ubiquinol. and obviously high-dose omega-3s because of the ubiquitous nature of everything that they do in your body. And if you can afford it, I would seriously look at TA65, specifically for the immunosenescence, but also for some of the other things like the cardiovascular benefits that have been documented. That's it in a nutshell. We hope to have more specific stuff, but you have to be patient with Dr. Gonzalez and I. Science takes a long, long time. We can't just whip these things up out of our heads. I mean, we have ideas, but to actually run them through the testing process, and that's primarily Dr. Gonzalez's belly, that is a very, very intricate and difficult process. So you have to give us a year or two, and we'll have something better for you than is out there, for sure. When you draw bone marrow and preserve the stem cells, do you increase the number of stem cells in the future? What if the person wants additional injections? So it looks like the question is from Joanne is asking as to what is the long-term effect. Let me sum it up this way, Dr. Gonzalez. Question one: when you take stem cells out of the body, are you robbing Peter to pay Paul? Are you taking stem cells away that you're not going to be able to regrow or give back? Number two, when you give stem cells, do they boost the number of stem cells in the body? Obviously they do, but how long does that last? And then what is the procedure for getting additional therapies? So are we robbing Peter to pay Paul? Do we boost the number, and how long does that last? And what is the procedure for additional therapies?
So when you remove stem cells from the body, it automatically forces your body to produce new stem cells. So they have to. So even though you may have stem cells in your body right now, like I said earlier, these stem cells may be dormant. When I remove them from your body, when we remove them from your body, we now force an activation of more stem cells to come in and actually take the place of the ones that were removed. Now I have an outside source of stem cells. The ones that you have inside of you still going to do their job. They're still going to do whatever they need to do. Remember, when someone gets sick, when someone gets ill, it's not because the stem cells didn't do their job. It's because there's a lack of homeostasis in your body. The stem cells may not know. They didn't have the right signaling cues to tell them, I need you to come over here and repair. I need you to do this, and I need you to do that. So what we're basically doing is that we're forcing this stem cell to be activated, to go back in and go to where they were before, to form a homeostasis that you had previously. Now by us removing the stem cells, we now actually have more stem cells that we're actually going to put in. And these stem cells that we remove, which are now activated, will go in and do what they need to do their job the correct way. The amount of time that these stem cells actually last varies in every single individual because every single body is different. And this also depends on you generally, how healthy you are. If you're an individual, let's say for instance, that was hypersensitive to gluten or has gluten intolerance, and all of a sudden you had stem cells and you felt phenomenal, and you said, I'm going to go ahead and go for the bread, and I'm going to do what I got to do because it's been a while since I've done this, and all of a sudden you become a little ill again. Now you're changing the homeostasis in your body. Now you may affect the stem cells that we put in that made you better, because now your immune system is going to take over, and it's going to, of course, do detrimental harm to you, and it's going to cause you to either revert back to the way you were before, or at minimum it may destruct some of the benefit that was actually done. So this is not, once again, as we said, this is not a cure-all. This is a step that you're going to take to make yourself better. But it's a big step that you're going to take to make yourself better, because it's a step that puts you in another category of feeling well, of being able to accomplish what you need to accomplish. You know, for instance, you know, the working out thing, it'll put you to another level so you can go out and compete again like you needed to, versus if you didn't do this therapy, you probably wouldn't. So this is that extra oomph that you may need. We don't know. I wish I can give it, you know, a definite answer. The therapy can last 6 months. It can last a year. I've seen people that have said, wow, ever since after the therapy, we're talking about 2 years into it, I am phenomenal. So it just depends. Every single one of us are different, and some people could take Tylenol, the other one's ibuprofen.
Right. So then the last part is the future injections. Those are done from the purified mesenchymal stem cells that Dr. Gonzalez produces.
Correct. We can produce a
And
lot of them.
yeah, and I should mention also, I believe very strongly that, when you're young, as Dr. Gonzalez mentioned, you have a much higher proportion of circulating stem cells. So essentially, we're reproducing that really youthful stem cell aspect in your body by giving you a couple 100 million cells, 100 million to 200 million cells. That's coming closer to what you had when you were born and when you were young. And we know that aging is primarily an epigenetic phenomenon. That was the methylation patterns that Dr. Gonzalez was talking about. And the genome doesn't change that much. There may be mutations in it. Many of them are simple passenger mutations. But what really changes is this epigenetics, which is which genes get turned on and which genes get turned off. And so by re-youthing your stem cell compartment, those stem cell chemokines and cytokines are circulating through your body at a much higher level than they were before. They're sending out messages to find damaged areas and repair them. They're sending out messages to the sloppily homeostased areas to improve them. And then finally, the other thing is they're shifting the epigenetics back away from inflammation towards that homeostatic or center point, if you will, that center mark that we want so much. So there's a lot of really intriguing benefits to having the stem cells. Next question, would it make sense to do the stem cell procedure before you bank them until you have fresh stem cells circulating in the bloodstream and the rejuvenation is stabilized and they have rejuvenated stem cells banked? That is logistically a difficult thing to do. It doesn't make a whole lot of sense because your stem cells, one of the things that really is part and parcel of making those stem cells work is not just their biologic age, and we do test them for function. Again, I think Leroy asked this question. We do test them for function, so we are making sure that you get really high functioning stem cells back. But some of it is also contingent on the number. You don't just walk around at 45, 55, 65 years old and say, bang, I've got 200 million cells like I did when I was 6. Okay, that's what we do. And there's absolutely no danger in that type of procedure, by the way. The first thing people say is, oh, if you get that many cells, it's a drop in the bucket compared to all the circulating cells. But it's a wonderful way to reboot the epigenetics, the immune modulation of your system, the whole aging process. But it's not just contingent on the quality, it's also contingent on the quality and the number. And this is one of the reasons why Dr. Gonzalez therapy is so effective, because he can give you 200 million pure mesenchymal stem cells, and you cannot get that in the United States. So bank as soon as you can, and count on the procedure and our screening procedures to make sure that you get effective cells. How much does stem cell therapy cost? We get this every time, Dan. I wish I could tell you. The problem is it varies from every single person. I can give you some baselines, approximate baselines. You're talking probably around $17,000 for the most simple therapies. It goes all the way up to 50 to for cardiac therapies, and probably even higher for neurogenic therapies. But there are ways to change this cost up or down a little bit, and there's also your individual makeup, and this is why we can't quote anybody a price, because we just don't know until we talk to you. Next question from Rashid again is their specific stem cell therapy for reversing genetic hair loss. We are working on that. Give us a year or two. I banked my son's cord blood with Viacord. I was wondering, can I use those stem cells, or I was wondering, can those stem cells be used by the parents? Absolutely. If the logistics are simple enough, we can use those. That's correct, Rafael?
No, actually, no. Those are cord blood. Those are cord blood stem cells,
yeah.
And those require, cord tissue you can, which most likely you didn't house any cord tissue with Viacord. Cord blood requires that you have. It's first and foremost, it's very, very few stem cells that are actually contained in cord blood, and that requires that you actually be a match. So you'd have to be no less than a 4 of a 6 match. The testing has to be done. The majority of times it's ideal that your 6 of 6 match, what's called a compatibility match, from your child, for you to use them. And even if you were, the amount of stem cells that are contained in that
Too
sample
small. Yeah.
is way too small compared to if I do a 100 ml extraction of bone marrow. I will actually have a lot more stem cells than what you have in that for the child. It's a big difference.
There you go. The last questions here about um, teeth, root canals. We can theoretically use any tissue that has viable stem cells and expand them. We prefer bone marrow because it's the simplest, easiest, and provides us with the largest number of cells to work with to begin with. But that doesn't mean we can't use other cells. Again, that's kind of a case-by-case basis. If someone has, dental tissue or dental pulp they want to use, provided it's healthy. I mean, most people are having root canals because they're
Exactly.
so that's
Yeah,
not
exactly.
really the best example of. You wouldn't want to use those stem cells.
Bacterial contaminated cells, yeah.
All kinds of stuff, just
Yeah.
that's why we believe in bone marrow. And the last question was, how can stem cell injections help? I think we've covered that. I think we've covered that to a great degree. So interesting. Thank you, audience. We're finally wrapped up. I want to remind everybody that you can get 15% off the Telomere Edge Packs. Use that coupon code TELECON. If you want to come down and see us in Guadalajara, you will write doc, D-O-C, at Dr. Dave's Best, DRDAVESBEST.com, and in the subject line write Tony and stem cells, and then just give us your contact info. And again, you may not be decided, but we're asking you to only do that if you're seriously considering doing it in the near to immediate future, because Tony is absolutely swamped, as you can imagine. There's very few places in this hemisphere where you can have anything like what we do done, and we have a unique way of preparing things. I haven't told you all about the amazing things about Dr. Gonzalez, but we're absolutely blessed to have him on this planet. I'm absolutely blessed to have him as a friend and colleague, and we're certainly blessed to have him working at Guadalajara, Mexico, in ReHealth, because Rafael has done things to improve this field and make it clinically relevant that nobody else is. And the beautiful thing about it is we're publishing the science to back up what we do, which I don't think most people are doing. It's just not happening. Or it's happening at such the far end of things, like over in Japan and Korea, where they're using them to treat, substantia nigra, degeneration, and Parkinson's, that it could never be clinically relevant. We're talking about clinically relevant stuff. And again, a lot of what we do is we try to make healthy people healthier. We're buying you runway. We're buying you lifestyle. We're buying you quality of life, disease mitigation. Again, we don't use the word cure, but we certainly are helping a lot of people live better lives. I believe that we're reversing the aging process, and we're going to be documenting that ad nauseum in the next couple of years. And we've got so many cool, exciting projects that will take us a little while to put into practice, but we're still bleeding edge doing just what we're doing right now. So come down and see us in Guadalajara. If you're in Yorba Linda, come visit Da Vinci Biosciences and Dr. Gonzalez. And we look forward to hearing from you and seeing you folks in the future. Thank you for your attention. It's always a pleasure, and thank you for being part of the anti-aging revolution. Thank you for having enough interest in what we're doing, what we're passionate about, to take good care of yourselves and to do the best that you can for yourselves and your family and your loved ones. Because I can't use the word guarantee you, but what I can tell you is I do this, Dr. Gonzalez does this. We practice what we preach. We believe very, very seriously and firmly that we are de-aging ourselves biologically, and that we want to do this for as many people as we can, because experienced, intelligent, passionate people, like the people that do this kind of stuff, and that includes you in the audience, because you wouldn't be here if you weren't interested in this. And it's a special group of people, which I love working with, a special group of people like this. Without special groups of people, the world would remain the same. We do not want the world to remain the same. We want it to be better, and we want to start with ourselves. Dr. Gonzalez, thank you so very much for your time and energy, as always. I look forward to speaking with you soon. You betcha. And Patrick, do you Do you have a winner we can announce, or well, I guess we can just send out the email directly to that person. So we'll do that. Some lucky person has won the stem cell, RG cell, cytokine, chemokine therapies. It's the serum, the booster, the cleanser, and also the toner. These are all new. Everything's new in this product line.